Welcome back to Ethnic Health America. In this segment, we're going to talk about adolescent medicine. Our special guest is Denise Lenoir. She's a family nurse practitioner with a specialty in adolescent medicine. Thank you for joining us. Tell us a little bit about your journey to health. I mean, how you decided to become a nurse and how you decided to go on to become a family practitioner.
Well, I started off in high school as a volunteer, a candy striper we were called in those days. Worked in a hospital and then decided I wanted to go to nursing school. Went to nursing school, got a bachelor's of science in nursing, and worked at Children's Hospital. That's where the majority of my professional career has taken place. Worked there for quite a while and was on the adolescent unit there, and ultimately became the assistant director of nurses there on the adolescent unit. Then I decided I wanted a change of pace. I wanted to become more hands-on and decided to go back to school and become a nurse practitioner. And that's what I did.
What's the difference really between a nurse and a nurse practitioner?
Basically, a nurse practitioner has more advanced training. And it was a 2-year program, and I came out with a Master's of Science in Nursing.
Tell me a little bit about your selection of adolescent medicine. What drew you to that particular field?
Well, adolescents, they have their own unique personality, unique dislikes and likes and dislikes and interests. They engage in risky behaviors, and for a provider, you really have to like, first of all, working with that type of patient. You have to like working with adolescents. You have to establish a rapport with them. You have to actually make the environment adolescent, teenage appropriate. And it's just a age group that I prefer to work with. I establish confidentiality with them. I establish a rapport, first of all, and I give them their own time, and we talk about everything. I do what we call a HEADS assessment on all of my patients. That's home, education. A is for activities, what they're doing outside of home, inside their home, outside of school, whether or not they belong to a church. Then D is for drugs, depression, and S is for sex.
Tell us a little bit about the confidentiality that you have obligations for with adolescents. I mean, many parents think that they can kind of join in the discussion with adolescents, but there are some rules, aren't there?
There are rules. I mean, basically, I have all the parents come in the room with the adolescent, and especially if this is my first time meeting them, and I tell them that I will give them time to talk with me, as well as I want time to talk with their child privately. Okay, anyone 12 years or older can give certain consent for family planning without a parent's consent. And adolescents may not really want to discuss certain things, certain issues with their parents or any other adult in the room, but their health care provider.
And you have an obligation not to report that
to their parents. Some parents understand, some parents don't.
What are some more common problems you see in adolescent medicine?
Risk-taking behavior.
That means
sexually active teenagers, teenagers involved in drugs, depression, acting out in school.
Are there some good teenagers?
There are. There are a lot of good teenagers. And there are a lot of teenagers that just need someone to talk to or someone for you to direct them for other services.
What are the some of the medical problems that teenagers have different from infants or younger children?
I would say primarily depression, obesity, lack of dental hygiene, good dental hygiene.
And are there special services or throughout the community, or throughout most communities, that lend themselves to care for adolescents?
Absolutely, absolutely. There are a lot of school-based programs where students can go if they don't feel comfortable with their health care provider. They can go to school and see someone in their school-based clinic.
Do you think adolescents look at health differently than adults or younger children or parents? And certainly younger children under the control of their parents. But do they see the need to do things on a day-to-day basis, or is their thinking process somewhat different?
Their thinking process is different. They don't think about tomorrow. They think about what's happening right now. A lot of risk-taking behaviors, and they want to be independent from their parents or any adult.
For a parent who wants to kind of plant the seeds of obesity or activity or academic, how early do you have to start that process?
I would say early childhood, very early. 6, 7 years old, you want to start in establishing boundaries, guidelines. Establish a rapport. Meal times is really important for all children, and especially adolescents.
In your practice time, do you think the incidence of adolescent obesity or have adolescents changed just that much? Are they different from when you were an adolescent, or even as you've been in your practice? Have you seen a change in either their perspective or problems?
Well, all adolescents go through very similar stages. I think now most parents are working adults, so they're not home. They're not spending a lot of time, family time with their teens. A lot of parents are afraid of their teenagers, and this leads to unhealthy behaviors.
Well, I think that certainly when you joined our practice, I didn't think that there was going to be a need for anybody to take care of adolescents. I was pretty wrong about that, and I have to thank you for the job you did with our own adolescents, in our own house. And now we got a new group of adolescents, so we're going to need all that skill set. So thank you for taking the time to join us.
Thank you.
We'll be right back after this break.